Our second prize has been set forward in memory of Dr. Michael Carr, a most successful chairman who was very academically minded himself. He was part of the Ofsted inspection team. And his wife, Mrs. Jenny Carr, has joined us today to present the second prize to Laxmi Thileepan for her work on psychosocial impact of Marfan on the family. Michael made a decision not to have his own children because of Marfan syndrome, but Jenny very kindly provided a huge family for him. So this prize, I think, is much related to family and how it responds to the diagnosis. Jenny, we got a few words? Can you unmute her, Victoria?
Jenny is
I've
there,
just
but
done
she's
that,
on mute.
hopefully.
I've asked her to unmute. One sec. She's
I've-
in a meeting. I'm just asking her to unmute.
I have unmuted. I don't know if you can see me or not, but I'm very pleased.
We've got you now.
Good. I'm very pleased to be part of this as well. As Anne has said, you know, my husband had a background in higher education, a scientific background. He was very keen on research and supporting the Sonali laboratory as well. The issues of family, Laxmi, are so important and often neglected. I know we used to have family information days in various parts of the country, and it was always humbling and revealing to talk to families on these days. I happen to have 3 children of my own and 2 foster children that Michael and I were able to adopt. So 5 children between us. And he made the decision not to tell them really till they were adults. And when an aortic dissection sort of forced him into it at the time, whether this was to avoid worrying them, I don't absolutely know. He himself learned he had Marfan syndrome when he was only about 15, when he saw an optician. And I can't help thinking of the effects on his family at the time. You know, a younger brother who was only about 13, and they were told that he wouldn't make it till the age of 30. And thankfully, as time has gone on with all sorts of developments, he was able to live on till 71. But, you know, that was always there, and it affects everyone in the family so much. All the worry and pressures and the stress and everything else. So I think all the research on the family side of things can only be good, because it's everybody who's affected, everybody who's involved. So you gave such a lovely presentation, Laxmi, and it was so good to hear your enthusiasm about it all. And I can only wish you well in the future. And it would be lovely if the medical side of things could all be aware of the effects on the family as well as on the patient themselves. So thank you so much.
Thank you. Thank you so much. I think, yeah, especially during medical school, I never really thought about family perspectives. So I think when I'm doing my clinical studies, it's quite good, because I think I do now take time to kind of consider how, if there is a new diagnosis, how the family feels, not just for Marfan syndrome, but for like any like disease or just anything, even if it's positive or negative news, how like the whole family would take it. So yeah. Thank you.
Thank you.
Lovely. Thank you very much, Jenny, for joining us. Good to see you.
Thank you.